more clinicians, which we are doing through that investment. He raises a point about Carr-Hill and the funding formula underlying general practice. Now, there is actually heavy weighting for deprivation, and the point that he raises is partly driven by the fact that older people tend to live in not the least deprived areas, younger people live in high IMD areas, and that's the reason for the statistic that he used. But of course, funding is rightly driven by health need, which is also heavily driven by age. This is an issue we are looking at, but I think the interpretation that he's putting on things, that there isn't a large weighting for deprivation, is not quite right.
Thank you, through.
Derbyshire, there are now 133 more full-time equivalent clinical staff in general practice than in 2015. That includes nurses, physios and clinical pharmacists. What more is my honourable friend doing to encourage more people to book an appointment with the most appropriate healthcare professional rather than simply defaulting to book a GP appointment?
An excellent question, Mr. Speaker. As well as having the extra 495 staff across Derby and Derbyshire, it's crucial that we use them effectively by having good triage, and that is why we are getting anxious England to financially support GPs to move over to better appointment systems, not just better phone systems, but also better triage as well.
We now come to topicals. We call Justin Matters.
Question number 1, please.
Mr. Speaker, I am pleased to announce that we will be developing and publishing a major conditions strategy. Around 60% of disability-adjusted life years in England are accounted for by just 6 conditions across cancer, cardiovascular disease, chronic respiratory disease, dementia, musculoskeletal disease and mental health. An increasing number of us live with one or more of these conditions. Tackling them is a significant opportunity to improve the lives of millions of people and support our goal to improve healthy life expectancy. This work will bring together our existing commitments to develop plans on mental health, cancer, dementia and health disparities, and our new strategy will shift our focus on integrated whole-person care, with a focus on prevention, early detection and the use of innovative technology to improve patient outcomes. It will also improve how the NHS functions, relieving pressure on hospitals, promoting integration and putting us on a sustainable long-term footing. We look forward to involving partners in the NHS, the charitable and voluntary sector and industry in developing this important work. And Mr. Speaker, further detail about the strategy is included in my written statement published today. The statement also confirms that we will publish a suicide prevention plan this year, building on the important work of my predecessor, the Right Honourable Member for Bromsgrove, and I look forward to updating the House in due course.
Matters.
Thank you, Mr. Speaker. During the passage of the Health and Care Bill in 2021, the issue of safe staffing levels in the NHS came up, and the government told us that they, and I quote, "do not believe that there is a single ratio or formula that could calculate what represents safe staffing." So isn't the truth that the Minimum Services Bill before us now is not about safe staffing levels, but about preventing nurses, doctors and paramedics from exercising their fundamental right to withdraw labour because they have lost all confidence in this government?
Well, the honourable gentleman is right to say it is a fundamental right that people are able to strike, and the legislation will balance that right in the same way that other countries in Europe does, with minimum safe staffing levels. And that is something that the French government have, the Italians have, many other European countries have, and it's simply bringing the English NHS in line with other health systems.
Sarah Atherton.
Wrexham Mailer Hospital was built in 1934 and is no longer fit for purpose. It's been divided, subdivided with modular add-ons. It's a labyrinth of rooms, ageing departments and corridors. I trained there as a nurse in 1990, returned during COVID, and there's been little improvement. It's no longer fit for a new city. So healthcare has devolved in Wales. The Welsh Labour Government have received the largest funding settlement since devolution began. So would the Minister agree with me that Welsh Labour need to listen to the people of Wrexham and build us a new hospital?
He makes an extremely powerful point, and I hope the Labour-run NHS in Wales takes heed to the comments she brings. She brings professional experience to this issue, and she's absolutely right that there needs to be that investment in the NHS estate in Wales.
We now come to Shadow Secretary of State West Streeting.
Thank you, Mr. Speaker. Labour founded the NHS to be free at the point of use, and we want to keep it that way. Given the Prime Minister has advocated charging for GP appointments, and one of his predecessors has also urged the Secretary of State to charge for A&E visits, will the Secretary of State take this opportunity to rule out any extension to user charging in the NHS?
Well, Mr. Speaker, I think I can see from your reaction and certainly the reaction of colleagues in the House that is a misrepresentation of the Prime Minister's position. I simply point out for the majority of years of the NHS's existence, it has been run by Conservative governments. We are committed and we remain committed to treatment free at the point of use. That is the Prime Minister's position, that is the government's position.
Where's Treaty?
Thank you, Mr. Speaker. I noticed the Secretary of State didn't rule out any future extension of user charging, and I'm sure patients will have noticed too. But given that the Chief Executive of NHS England has said that the NHS needs to expand training, given that many of his own backbenchers are now echoing Labour's calls to double the number of medical school places, and given that he has no plan whatsoever to expand NHS medical school training places, nursing and midwifery clinical training places, doubling the number of district nurses qualifying, or providing 5,000 more health visitors, isn't it time the Conservatives swallowed their pride, admit they have no plan, and adopt Labour's workforce plan instead?
Well, I'm not surprised, Mr. Speaker, that he wants to misrepresent the government's plan, not least because his own plan is disintegrating before his own front bench. I mean, not only have members such as the member that spoke earlier talked about how his plans... well, I'm trying to remember her constituency, so I can give her name, Mr. Speaker, but in the House one should give the name of the constituency. York Central, my colleague, the member for York Central, has contradicted, as I drew the House's attention to earlier. Not only has his own shadow bench, front bench, contradicted it, but even the deputy chair of the BMA has said that Labour's plan would create higher demand and longer waiting times. I'm not surprised that he doesn't want to talk about his own plans anymore, which is why he's taken to distorting ours.
Who's waiting to talk? Paul Holmes.
Thank you, Mr. Speaker. Eastleigh, Hedge End and the villages have many vibrant pharmacies, but it is disappointing that Lloyds are to close 2 branches in my constituency. I welcome the additional £100 million that this government is investing in community pharmacies, but can my right honourable friend confirm how this funding will cut NHS waiting times and, more importantly, reverse this trend of closures?
Is quite right. Although pharmacies are private businesses, we invest £2.5 billion in the clinical services they provide. We put in another £100 million in September so they can provide more clinical services. And the number of community pharmacists is up 18% since 2017. We've introduced the pharmacy access scheme to make sure that we can support pharmacies in areas where there are fewer of them. But clearly the solution for pharmacy is for them to be doing more clinical work, taking the burden off GPs, providing accessible services, and that is exactly what we're going to keep growing.
SNP spokesperson Martin Day.
Thank you, Mr. Speaker. When I brought up the issue of pension tax rules in November, the Secretary of State agreed that pensions were an important issue and that he would be meeting the Chancellor later that day. Can he give us an update on the progress that the Cabinet colleagues are making to provide a permanent solution that will help in retaining NHS staff?
Well, those discussions are ongoing with my right honourable friend, the Chancellor. He'll know that we made progress in the summer on a couple of areas in respect of pensions, but there are further discussions which my right honourable friend, the Chancellor, is discussing with us in the context of pensions.
Dr. Luke Evans.
Thank you, Mr. Speaker. Can I declare an interest as a GP and immediate family who are GP and doctors? Now, GPs are working incredibly hard in tough times, and it's true that supply has gone up, but so has demand. Change needs to happen in primary care, but one of the bedrocks is the GP partnership model. Does this government agree?
Thank you, Mr. Speaker. Unlike the opposition, we don't regard GPs' finances as murky, and unlike them, we don't want to go back to Labour's policy of 1934 and try and finish off the business that even Nye Bevan thought was too left-wing. We don't believe in nationalising GPs. We do believe in the current model. We don't believe that people who've got a problem should just immediately go to hospital, driving up costs, undoing the good work of cross-party consensus the last 30 years, a plan which was supposed to cause a splash on a belly flop.
Mr. O'Brien, when I move on, I expect you to move on with me. I've got all these backbench who need to get in. I don't need the rhetoric. I want to get members in. I want to hear them, not you.
UK is the 6th largest and richest economy in the world, yet data from the Food Foundation showed that 9.7 million people in September on these islands lived in food insecurity. That malnutrition, that kind of thing, does not have a good impact on the health service. So when will ministers pick up the phone or nip along the corridor to the Department of Work and Pensions and tell them to drop their punitive sanctions regime that pushes so many people into poverty and puts so much problems onto the NHS?
We are concerned with the exact same issues. The £900 cost of living payment for £8 million households is exactly how we're trying to address it. It's also why we're bringing in the largest ever increase in the national living wage for 2 million workers.
Priti Patel.
Speaker, the Secretary of State is very well aware of the challenges facing Essex mental health and the independent inquiry there into so many patients that have died. Can he please tell the House and my constituents what steps is he undertaking to look at making this a statutory inquiry?
My right honourable friend raises an extremely grave and serious issue, one that I know is of concern to a number of colleagues. Following representations from parliamentary colleagues, I have had discussions with the chair of the inquiry, and following that I had discussions with the Chief Exec and leadership team in terms of the level of engagement with the inquiry, and that is an issue that we are, my honourable friend, are very closely involved in, and I'm very happy to have further discussions with my right honourable friend.
Thank you, Mr. Speaker. While the government has slashed medical school places by a third, Labour is committed to doubling the number of places to train a new generation of NHS staff. Will the Minister support me in backing the University of Portsmouth's bid for a much-needed medical school for my city?
Well, firstly, he's just factually wrong, Mr. We've increased medical undergraduate places by a quarter. I was actually in the department at the time the decision was taken, so he's just wrong on the facts. But also, we need to look at new ways of getting medics in, actually having more diverse recruitment in terms of the social profile from which we recruit, and that's why the apprenticeship route, I think, is an extremely important one and one I'm keen to expand.
Select Committee, Steve Brown.
He looks forward to hearing about the conditions strategy and engaging with it, as I hope ministers will engage with our major prevention inquiry launched last week. Now, one of our national newspapers has contacted 125 acute trusts and asked them about visiting rights. 70% of them still have some form of restrictions in place, most commonly limiting the time that people can spend with their loved ones and the number of people that can sit by the bedside. This was 19th of May last year. The Chief of NHS England said that we should return to pre-pandemic levels.
Order. He may be the chair of the Select Committee. He does come in. I've got to get other people in. It's not just his own show. Please, Minister.
Well, Mr. Speaker, I thank the honourable friend for his question. National NHS guidance is absolutely clear. Providers are expected to facilitate visiting for patients in hospital wherever possible and to do so in a risk-managed way. It is up to individual providers. They do have discretion, but I do understand the benefit that this brings to patients. It's a very important factor, and I will be meeting with NHS England to discuss this further.
Thank you, Mr. Speaker. According to a recent CQC report, black people experiencing mental health crises are 11 times more likely to be sectioned and to receive restricted and violent community treatment orders. So can the Minister say how he will tackle these inequalities and how he will implement the recommendations in the report?
Well, can I thank the Honourable Lady for her question? She's absolutely right that black and ethnic minority groups are more likely to be detained under the Mental Health Act. We are planning to reform the Mental Health Act. There's been pre-legislative scrutiny on that, and I'm hoping that when we reform that Act, there will be an improvement in those figures.
Kelly Tolhurst.
Mr. Speaker, the Kent and Medway ICB reported that we had an increase of over 230,000 GP appointments were offered to patients between September 20 and 22. However, Medway has some of the lowest numbers of GPs per head in the country and demand has increased. What support is my right honourable friend's department giving to the ICB to further increase the access to GP appointments in Medway?
Well, firstly, I welcome the increase in appointments and the numbers that she draws the House's attention to. There is targeted funding of up to £20,000 for those areas that are having difficulty recruiting. I'm very happy to discuss with her how we ensure that Medway is able to adequately access that fund.
Mr. Speaker, why is the government continuing to delay its consultation on regulation for physician associates? As constituents of mine who are physician associates point out, they could be doing much more to perform vital duties and relieve pressure in our hospitals, which I'm sure ministers would agree we desperately need.
Well, I agree it's an extremely important issue and I'm keen to expedite it, and we're having very urgent discussions on how we maximise the use of physician associate positions. So she raises an extremely important point. Obviously it's one that we're discussing with the DAs as well because it applies across the United Kingdom, but it is an important area and one I'm keen that we move on quickly.
Anna Firth.
Speaker, the Future of Pharmacy report was published yesterday, highlighting again the funding pressures on the sector, including for the brilliant Belfairs pharmacy in Leigh-on-Sea, who ask, would the Minister consider urgently reviewing, writing off the £370 million of COVID loans given to pharmacies during COVID-19?
Mr. Speaker, we're working to increase the amount of funding going into pharmacy so they can do more clinical services. I'll look closely at the issue that the Honourable Lady raises.
Matt Weston.
Thank you, Mr. Speaker. Last week the government decided to mothball the COVID-19 testing facility in Leamington, leaving up to 670 people without their job. The lab was reputed to cost over £1 billion. Perhaps the Minister could confirm that. But I was also promised, when that investment was made, that the lab would be used for other purposes, pathological testing and other diagnostics. Why isn't that happening?
Well, as the honourable gentleman will know, we discussed this over the telephone last week. The decision to wind down the Rosalind Franklin laboratories because the number of PCR tests have reduced significantly and NHS laboratories can take that capacity. There is a residual service and for additional use of the laboratory is being considered at the moment.
Because
Speaker, I recently met with a dentist in my constituency whose practice group operate over 19 different sites, and the UDA rate ranges from £25 to £36. He's firmly convinced that in order to attract NHS dentists to an area such as my Cleethorpes constituency, there needs to be a uniform UDA rate. Could the Minister have a look at that, please?
Absolutely, Mr. Speaker. This is one of the issues we are looking at. We've already brought in that new minimum UDA value and we're allowing to deliver more, but we will look at measures to encourage people to work in the areas that have got the greatest shortages.
Speaker, on World Cancer Day 2022, the former Secretary of State announced a 10-year cancer plan to make us a world leader. Today, cancer services are bucking under immense pressure. Can Government and the Minister confirm that the strategy will be fully resourced and commit to working with cancer charities to ensure that the 10-year strategy is delivered? Thank you.
Right now, we are seeing more people come forward for cancer diagnosis or to be given the all clear. We're supporting services right now with an extra £8 million going into elective recovery, £8 billion going into elective recovery. Also, cancer is a very important part of our major condition strategy just announced by the Secretary of State because we're determined to include patients' outcomes from cancer.
Speaker, in today's Shropshire Star, which is my local paper, there is an 8-page spread on what is happening to healthcare in Shropshire. It is described as a war zone. Will the Secretary of State meet with me and other Shropshire MPs to discuss the challenges we face in Shropshire?
Well, I'm very happy to meet with my honourable friend and discuss the issues in terms of Shropshire, but I simply draw her attention to the fact that we have got more doctors, more nurses, more funding going into the NHS and more people being treated.
Thank you, Mr. Speaker. In light of the government's welcome announcement of the strategy rapid review of inpatient mental health services, can we now please revisit the decision by NHS North West London Trust to make the COVID closure of the Wolsey ward permanent, leaving Ealing, third biggest borough in London, with no acute mental health beds for under 65s?
Yeah.
Well, local healthcare decisions are made by local commissioning groups. I'm very happy to raise that on her behalf, but just to say that we are putting an additional £2.3 billion a year to expand and transform mental health services, both in the community and inpatient services.
Morris. Well, I welcome the new investment in emergency mental health services that was announced this week. Would the Minister agree with me that we mustn't lose sight of the fact that we need to have a plan, a long-term plan for the transformation of mental health services so that we achieve that goal of parity of esteem between mental and physical health in the NHS?
Well, I do agree, and that's why the long-term plan in particular signalled the importance of mental health and in particular parity to which he speaks. It is also why, as my honourable friend just referred, there is additional funding being targeted to mental health, the extra £2.3 billion a year from 2024, signalling this government's commitment to mental health, as he will have seen with the announcement in terms of mental health ambulances this week.
Liz Twist.
Thank you, Mr. Speaker. Suicide rates in England are as high now as they were 20 years ago, yet the written ministerial statement today simply says a strategy will be published later this year. Saving deaths by suicide can't wait. When exactly will the suicide prevention strategy be produced?
Well, what we signalled, and what I agree with her, is the importance of the suicide prevention plan. It is something my predecessor, the Right Honourable Member for Bromgrove in particular, highlighted. It is something I'm keen to work with him and members across the House. And what I set out in the written ministerial statement today was not a specific date, but our commitment to a bespoke plan, and I'm very happy to work with her and other members on that.
Jack Brereton.
Mr Speaker, current plans for community diagnostic hubs in North Staffordshire would see only a single facility which is meant to serve over 500,000 people. This is totally insufficient, so will the Secretary of State look at my suggestion that there should be 2 of these facilities within North Staffordshire?
Mr Speaker, I'm very happy to meet with my honourable friend to discuss this further.
Richard Bergen.
Thank you, Mr Speaker. Will the Secretary of State for Health today, on the record, condemn the call from his predecessor to impose charges on visits to the GP or to A&E?
Well, Mr. Speaker, I'm not sure how many times one needs to say the same point. The government's position on this is clear. We are committed to treatment free at the point of use. That is the government's position, and it has been throughout the NHS's history, the majority of which has been run under Conservative governments.
The operations have been lost to strike action in the NHS so far.
Well, Mr Speaker, on an average strike day, I believe it's around 2,500.
Charlotte Nichols.
Thank you, Mr Speaker. The most recent figures published by the UK HSA show that last year the rate of syphilis cases reached its highest since 1991, and the total number of cases hit its highest since 1948. This shocking increase in syphilis transmission is just one reason why we need the government to set out its vision for sexual and reproductive health in its long overdue Sexual and Reproductive Health Action Plan. Can I therefore ask the Minister to set out when the plan will be published and what he is doing to stop the spread of syphilis?
Can I just reassure the Honourable Lady that we take this sexual health services very seriously. Local authorities in England have received more than £3 billion from government to support these services. We have produced a number of plans to improve sexual and reproductive health, from the HIV Action Plan in 2021 to the Women's Health Strategy, which focuses on sexual health as well.
Final question, Maggie Through.
The Party Group for Diagnostics will hold its inaugural meeting on the 8th of February with plans to conduct a short inquiry with the aim of providing a blueprint for how community diagnostic centres should operate in the longer term. As part of the inquiry, will my right honourable friend commit to meeting with members of the group in order to discuss what more the government can do to maximise the role of diagnostics in addressing the pressures on the NHS?
Very happy to give my honourable friend that commitment, and she's absolutely right to highlight the centrality in terms of diagnostics and its importance in our overall plan to get the elective numbers down.
We now come to the urgent question. Just let members go. One second. We've come to Caroline Lucas, urgent question.
Thank you, Mr Speaker, to ask the Home Secretary if she'll make a statement on the steps she's taking to find missing, unaccompanied asylum-seeking children and to keep them safe.
Minister.
Thank you, Mr Speaker. The rise in small boat crossings has placed a severe strain on the asylum accommodation system. We've had no alternative but to temporarily use specialist hotels to give some unaccompanied minors a roof over their heads whilst local authority accommodation is found. We take our safeguarding responsibilities extremely seriously, and we have procedures in place to ensure all children are accommodated as safely as possible whilst in these hotels. This work is led on site by personnel providing 24/7 supervision with support from teams of social workers and nurses. Staff, including contractors, receive briefings and guidance on how to safeguard minors, while all children receive a welfare interview which includes questions designed to identify potential indicators of trafficking or safeguarding risks. The movements of under-18s in and out of hotels are monitored and recorded, and they're accompanied by social workers when attending organised activities. Mr Speaker, we've no power to detain unaccompanied asylum-seeking children in these settings, and we know some do go missing. Over 4,600 unaccompanied children have been accommodated in hotels since July 2021. there have been 440 missing occurrences and 200 children remain missing, 13 of whom are under 16 years old and only one is female. When any child goes missing, a multi-agency missing persons protocol is mobilised alongside the police and relevant local authority to establish their whereabouts and to ensure that they are safe. Many of those who have gone missing are subsequently traced and located. Of the unaccompanied asylum-seeking children still missing, 88% are Albanian nationals. The remaining 12% are from Afghanistan, Egypt, India, Vietnam, Pakistan and Turkey. As I've made clear repeatedly, we must end the use of hotels as soon as possible. We're providing local authorities with children's services with £15,000 for eligible young people they take into their care from a dedicated UASC hotel or the reception and safe care service in Kent. Mr. Speaker, I fully understand the interest of the Honourable Lady and indeed the whole House in this issue, and I'm grateful for the opportunity to address it. I can assure the House that safeguarding concerns are and will remain a priority for me and for my department, as we deliver broader reforms that are so desperately needed to ensure that we have a fair and effective asylum system that works in the interests of the British people.
This is horrific, Mr. Speaker. Vulnerable children are being dumped by the Home Office. Scores of them are going missing, and I can tell the Minister there is nothing specialist about these hotels. We are not asking him to detain children. We are asking the Home Office to apply some basic safeguarding so we can keep them safe. Does the Minister know how many have been kidnapped, trafficked, put into forced labour? Where they're living? Are they allowed to leave? Are they in school? Well, he should know, because the Home Office are running these hotels. They've told me they're commissioning everything from social work to security. But what's still not clear is whether they're prepared to take legal as well as practical responsibility. Meanwhile, these children are in legal limbo. I was told before Christmas that government lawyers were deliberating over their ultimate legal responsibility. We need to know the outcome today. What is it? We need to know why successive Home Secretaries have played into the hands of criminal gangs. The Minister will talk of new money being given to local authorities, but where will they get the foster care capacity? He knows it's in seriously short supply. Brighton and Hove City Council has been raising concerns about the dangerous practice of using these hotels for 18 months. And as the Honourable Member for Hove has made clear on many occasions, and I pay credit to his tireless work on this, it was entirely foreseeable that children were at risk of being snatched, abducted and coerced by criminals. Has the Minister taken up offers of help from charities working with children? What is the response to the migration watchdog's finding that some staff in these hotels were not DBS checked? What role is the Children's Commissioner playing? Why isn't Ofsted inspecting these hotels on a regular basis? Will he commit to publishing regular data on missing children, how long they've been missing, whether they're still missing, when they went missing? Where is the special operation to find the missing children? This feels like the plight of girls in Rotherham, who were treated like they didn't matter, and frankly, it is sickening. And lastly, Mr. Speaker, the use of these hotels must stop. When will that actually happen? Mr. Speaker, the staggering complacency and incompetence from the Home Office is shameful. We need immediate answers, we need an urgent investigation, and we need to ask how many more children are going to go missing before we actually see some action.
Thank you, Mr. Speaker. Well, if the Honourable Lady hasn't visited the hotel in her constituency, I would be happy to organise it, or indeed in her neighbouring constituency. I spoke with the Chief Executive and Director of Children's Services of Brighton and Hove Council yesterday to ask them for their reflections on the relationship with the Home Office and the management of the hotel. We have a good relationship with that council, and I want to ensure that continues. As regards the level of support that's provided in that hotel, and indeed others elsewhere in the country, it is significant. On any given day, there will be a significant security presence at the hotel, and those security guards are there to protect the staff and the minors, and to raise any suspicious activity immediately with the local police. and I've been assured that that does happen in Sussex. There's also a number of social workers on site 24/7. There are also nurses on site, and there are team leaders to manage the site appropriately. So there is a significant specialist team provided in each of these hotels to ensure that the young people who are present are properly looked after. And the recent ICIBI report in October last year, for which Ofsted was actually involved in the inspection, I believe, did find unanimously that the young people reported that they felt safe, happy, and treated with respect. Now, that doesn't mean that we have any cause to be complacent, because it's extremely concerning if young people are leaving these accommodation settings and are not being found. I've been told that any young person leaving one of these hotels and not returning is treated in exactly the same way as any young person who goes missing of any nationality or immigration status anywhere else in the country, and that the police follow up as robustly as they would in any other circumstance. And that's quite right, because we have a responsibility to any minor, regardless of why they're here in the United Kingdom. We've also, working with police forces and local authorities, created a new protocol, which is known as Missing After Reasonable Steps. And this takes further action to find missing young people and has had significant success. I'm told that that's led to a 36% reduction in the number of missing occurrences. We will take further steps as required to ensure that young people are safe in these hotels and are not unduly preyed upon by the evil people smuggling gangs which perpetuate the trade. The key task ahead of us, other than of course deterring people from making this dangerous crossing in the first place, is to ensure that these young people are swiftly moved out of the hotels, as she rightly says, and into more appropriate settings in local authorities. What I've done since being in position is to review the offer that we have for local authorities and significantly enhance it. So from next month, and this is already announced, any local authority will receive a one-off initial £15,000 payment for taking a young person from one of these hotels into their care, in addition to the annual payment, which is around £50,000 per person. And that's a very significant increase in the amount of financial support that's available to local authorities. She's of course right to say that money is not the only element, the only barrier to local authorities, because there are significant capacity issues, a lack of foster carers, a lack of trained social workers, a lack of local authority children's home places. And those are issues which the Department for Education is seeking to address through their care review. And the best thing, of course, any of us can do as constituency members of Parliament who care about this issue is to speak to our local authorities and ask them if they can find extra capacity to take more young people through the National Transfer Scheme, and so we can close these hotels or at least reduce reliance upon them as quickly as possible.
I share the concern over this story, but it's actually not new news. The Home Office came in front of the Home Affairs Select Committee last year to be interrogated about this, and there was a particular problem with this hotel in Hove which instigated the story in the Observer at the weekend, because the Home Office didn't actually tell the local council when it was putting children there in the first place. However, there have not been any reports to Sussex Police of children actually being snatched and abducted by these gangs outside. However, there are two questions which the Minister may like to clear up. There is a grey area over who is responsible as the safeguarding body for children in those hotels. Is it the Home Office or is it the local authority? Because there seem to be different stories. And secondly, is he using specialist refugee children's charities, as he has done at Dover and other ports of entry, to look after these children in the hotels who do have the welfare and safeguarding training to make sure they're not being taken advantage of? Because they are not criminals. We cannot put them in a secure facility. They are free to come and go, but we need people keeping a special eye on them.
Well, I'm grateful to my honourable friend for those questions. He's right to make the final point, which is that these are not secure locations. Young people are not detained in them. We don't have the legal powers to do that, and I don't think any honourable and right members across the House would wish us to. And so it is inevitable that some young people will choose to leave these settings, as very sadly they do from local authority care homes as well. But that's not to diminish that or renege on our responsibility to reduce that as far as we possibly can. We do have relationships with charities and the voluntary sector, and I'll happily take up with the department whether there's more that we can do there. We have made good use of those relationships in other settings, such as hotels for adults and at Manston, for example. As I said earlier, there is a very significant amount of specialist support in these hotels, and I specifically asked the officials running them what we would find on any given day, and it is several security guards, a number of nurses and a number of social workers, as well as team leaders running the operation. And so they are well staffed, and they are well staffed by well-trained and professional individuals who are drawn from other settings where they're used to looking after vulnerable young people. And lastly, on the first point that the honourable gentleman made, there is a challenge around the legal status of a local authority with respect to these hotels. Our objective, of course, is to reduce demand for these hotels as fast as possible, and so that young people are simply in this accommodation for a very short period of time whilst we get them into local authorities where they can be cared for properly in accordance with the law.
Shadow Secretary of State, Yvette Cooper.
Thank you, Mr. Speaker. The report from Sussex Police is that 1 in 4 unaccompanied children in a Home Office hotel have gone missing. 1 in 4. And around half of them are still missing. It would appear from the figures that he's given that this means one hotel accounts for 40% of the missing children. And a whistleblower has said, is reported to have said, children are literally being picked up from outside the building, disappearing and not being found. They are being taken from the street by traffickers. We know from Greater Manchester Police, they've warned, asylum hotels and children's homes are being targeted by organised criminals. And in this case, there is a pattern here. The gangs know where to come to get the children, often likely because they trafficked them here in the first place. There is a criminal network involved, and the government is completely failing to stop them. They are letting these gangs run amok. Last year, there was only just one conviction for child trafficking, even though it's now believed to involve potentially thousands of British children as well as these children being targeted here. So where is the single coordinated unit involving the National Crime Agency, the Border Force, the South East Regional Organised Crime Unit, the local polices, to hit the gang networks which are operating around this hotel and across the Channel? Why are they still refusing to boost the National Crime Agency, and why have they repeatedly ignored the warnings about this hotel and about unregulated accommodation for 16 and 17-year-olds being targeted by criminal gangs? It is unbelievable. There is still no clarity about whether the Home Office or the Council are legally responsible for these children. So will the Home Office now agree to immediately end the contract with this hotel and move the children out to safer accommodation? Will they set up a proper inquiry and team to pursue the links between organised crime, trafficking and the children in these hotels? Because this is a total dereliction of duty that is putting children at risk. We need an urgent and serious action to crack down on these gangs and to keep children and young people safe.
Minister.
Well, I gave the Right Honourable Lady the figures that the Home Office had at the start of this urgent question, which is that of the 4,600 unaccompanied children who've been accommodated in hotels since July 2021, 440 have gone missing at one point. 200 remain missing. So I'm afraid that the statistics that the Right Honourable Lady quotes are not those that I've been given by the Home Office. With regard to the press reports that individuals have been abducted from outside the hotel, well, those are very serious allegations, and I've specifically asked the officials who run this hotel whether they've seen evidence of that, and indeed I asked the senior leadership of Brighton and Hove Council. I've not been presented with evidence that that has happened, but I will continue to make inquiries, and senior officials from my department are meeting with the mighty security team in the coming days to ask them whether they have seen any occurrences and whether the individual who's quoted in the press as a whistleblower raised issues with Mighty. If they did, why those issues were not subsequently passed on to the Home Office. So she has my assurance that I'm not going to let the matter drop. And I'm also going to meet a number of staff who work at the site in the coming days to take their opinions and reflections as well. On the broader point she makes about our policy, she's incorrect when she says that the NCA is insufficiently financed. The Prime Minister announced at the end of last year that we would be stepping up the funding of the NCA. And in fact, I visited the NCA just last week to be briefed on the work that they're doing upstream throughout Europe into Turkey, Iraq and a number of other countries. There is very significant activity happening to tackle the evil people smuggling gangs. And the problem that the Right Honourable Lady has is that she doesn't support any of the measures that the government brings forward to stop this trade. She votes against every act that we bring forwards to try to address this challenge. And there is nothing compassionate about allowing unsecure borders and growing numbers of people, including young people, from crossing the Channel. And she will have her opportunity to put her money where her mouth is when we bring forward further legislation in the weeks ahead.
Edward Timms. Mr. Speaker, what assessment has my Right Honourable Friend's department made of the availability of specialist foster carers able to accommodate unaccompanied asylum-seeking children? And in light of the Abdul Rahimzai case reported today, can he reassure the House that those foster carers are being provided with the information and support that they need to keep both themselves and any young person in their care safe?
My Right Honourable Friend raises a very important issue. There is a lack of capacity, as he knows as well as almost anyone in this House, of specialist foster carers, and that is why the Department for Education conducted its care review, is considering the findings and will be bringing forward recommendations in due course. Most of the young people that we see in the hotels that we're discussing today are older. They are predominantly 16 and 17-year-olds. And so it is not only a national lack of foster care capacity, but also of supported accommodation and the kinds of settings that a 17-year-old, for example, might be placed in for a relatively short period of time before they move forward with their lives. Those are issues, obviously, which are very important to us. That's why, for my part, I have made available significantly increased funding for local authorities so that they can, for example, use that money to procure more supported accommodation. With regard to the case that he referred to, this is a truly shocking case. We are reviewing how this has happened, how this individual was able to enter the UK posing as a minor, and we will learn the lessons from this and set out more in due course.
SNP spokesperson Alison Thewlis.
Thank you, Mr. Speaker. It is completely unacceptable that vulnerable young people who need care and support continue to vanish under the Home Office's watch. The Children's Commissioner for England has made her concerns clear around the safeguarding of these young people. Has he met with the England Children's Commissioner? Has he considered an equivalent to the Scottish Guardianship Service, which provides personalised and sustained support to unaccompanied refugee children? Would that be a useful model to keep these young people safe? Sussex Police say 76 children are unaccounted for in this case, and the Minister has said that 440 children had gone missing and 200 remained unaccounted for across the UK. Is he certain of these figures, and will he provide regular updates to the House on the number of children missing and still unaccounted for? And will he end the practice of putting children in hotels, a practice that many stakeholders and whistleblowers have repeatedly flagged as dangerous and putting children at risk?
Well, I want to end the practice of putting children in hotels, but the key to that is to stop people crossing the Channel in the first place. And if we continue to have tens of thousands of young people, well, of people, including very significant numbers of minors, crossing the Channel every year, then there is no choice, I'm afraid, but to accommodate people for a short period of time in hotels before they can flow into better accommodation within local authorities. And she and others across the House should appreciate that this is a national emergency. It is part of a global migration crisis, and we need to take the most robust action we can to deter people from making this journey, or I'm afraid we will find this problem magnify in the years to come. That's why we've taken the steps we have in the recent past. That's why the Prime Minister set out his plan at the end of last year, and why we'll be bringing forward legislation shortly, which I hope she and her colleagues will support. I will certainly look into the Scottish guardianship model that she raises. I've said this many times previously, but it remains true that as a proportion of their population, Scotland does take far fewer UASCs than England. And so one practical step the Honourable Lady could do is to encourage the SNP government and local authorities in Scotland to play a fuller part in ensuring that these young people are given the care and attention they deserve.
Kit Malthouse.
Mr. Speaker, I know that the Minister cares profoundly about the fate of these children. It's reassuring to hear the assertive action by local authorities and police when they do go missing. However, if dozens of children had been going missing, say, from boarding schools across the country, I have no doubt there would be a national mobilisation at the NCA and indeed the National Police Youth Council. So could he just enlighten us to what that national response looks like at the moment in British policing, and whether he feels more could be done to address this systemic problem, not least given the possible links to serious and organised crime?
Well, my right honourable friend is absolutely right, as I made clear earlier, that we should treat any child who goes missing with all the same focus and intensity of effort, regardless of their background, their nationality and immigration status. And that is exactly what happens in this case. If a young person leaves the hotel, for example, the one we're discussing this afternoon, and does not return within 4 hours, then that is immediately recognised as a missing person. The local police, in this case Sussex, are contacted, and it is treated with all the same effort as it would be any other individual. That is why a significant proportion of these young people have fortunately been found and returned to care, but too many have not. And so I think he makes a valid point that we should be working with local police forces and others to see whether the procedures we have in place are sufficient or that we need to go further. That work was done last year, and that led to the new protocol that I described earlier, which from the numbers that I've received has made an impact in reducing the number of occurrences by around a third. But if there are further steps that we should be taking, then we will do. And this is a broader challenge because the numbers who are going missing from these settings is not dissimilar, sadly, from the numbers going missing from local authority children's homes. And so we should be applying all the learnings that we have from this to local authority settings as well.
Chair of the Select Committee, Dame Diana Johnson.
In July last year, the Home Affairs Select Committee actually raised our serious concerns about unaccompanied asylum-seeking children going missing from hotels. And if I could assist the Minister, the Home Office's Permanent Secretary, Sir Matthew Rycroft, told the committee that, broadly speaking, it is the Home Office which acts as the safeguarding authority for a child placed in a hotel. So we called on the government to provide a clear timeline for ending the accommodation of children, unaccompanied children in hotels. So can I just press the Minister today, because that hasn't been forthcoming so far. Given its critical child safeguarding responsibilities, can we get a clear commitment today from the Minister as to what date they will end the clearly unsafe and unsatisfactory placement of unaccompanied asylum-seeking children in hotels?
I respect the Right Honourable Lady and her committee, but it isn't as simple as me being able to set a date at which these hotels will close, because we have to be honest with ourselves about the challenge that we face as a country. There are hundreds, if not thousands, of young people crossing the Channel on small boats every year. What we need to do is flow those young people as swiftly as possible into local authority care. But if local authorities do not have the capacity to take them immediately, bearing in mind that we can only detain somebody for 24 or now 96 hours with the recent legal change that we've made in a relatively short time frame, then we have to have a short period of bridging accommodation. And for as long as the challenge remains as pronounced as it is today, we will need that. So the task for us is twofold. One is to work with local authorities and provide the incentives for them to boost their own capacity, but the other is to deter people from making this crossing in the first place. And we're trying to do everything within our power to do that, including further legislative changes. But until we beat this trade, there will be young people placed in this position.
Sir John Hayes.
Thank you, Mr. Speaker. The particular vulnerability of children in distress touches our hearts, and it must move us to further action, as my right honourable friend said. So will he tell the House when the legislation he's described will come before us? And will he implore all of those who share my compassion and concern about these desperate children to support that legislation without equivocation? Because unless we deal with this problem at root, the sheer scale of it will overwhelm our capacity nationally or locally to protect these children. It is as simple as that.
Well, my right honourable friend is absolutely right. This is a symptom, a very serious and disturbing symptom of the problem, which is the people smuggling gangs luring tens of thousands of people, including a significant proportion of minors, across the Channel. And we have to do everything we can to deter those people and to break the business model of the people smugglers. That's what we're determined to do. That is the purpose of the legislation that we will bring forward very shortly. My right honourable friend and others only have a short period to wait until we present that to the House, and I hope it will have broad support, because if we don't address this, then all the evidence suggests that in the years to come, we will find this problem magnify, and tens, if not hundreds of thousands of people attempt to make this crossing.
Thank
you, Mr. Speaker. The Minister says that safeguarding these children is a priority for him. He will know that since October last year, I have been asking to see the safeguarding requirements that he has made of the private companies involved in running these hotels for both unaccompanied and accompanied children. I understand now why he was so reluctant to give it when I finally used a Freedom of Information request to get it. Wow. There is no mention at all in the requirements he's making of these private companies who are making millions of pounds running these centres to do anything about modern slavery or human trafficking. Not one word. Let's be clear, it doesn't matter whether these children are Albanian, Syrian, Pakistani or Iranian. It doesn't matter if they're boys or girls. They're children. Yes. Will he now use his responsibilities as the Minister responsible to require these companies to have a duty to prevent human trafficking and modern slavery, and finally make sure for all the money they're making out of this, they do something to protect these children, because it's under his watch that these children are going missing, and it's under his watch that he missed out that in the contract.
Well, the Honourable Lady and I have met and discussed this on a number of occasions. We take this very seriously. We have asked all of our providers, of course, to take their responsibilities for safeguarding seriously. We have a safeguarding hub in the Home Office, and we work closely with the local authorities, who also have a duty to support people in their care. With respect to the hotels we're discussing today, these are not run by private providers. There are providers that support us in terms of security arrangements, but these hotels are run by the Home Office, so she's not correct to say that they're run by external providers. But that doesn't change the reality, as I said on a number of occasions, that we should take the care of these minors as seriously as we would our own children, and I hope I've given her the assurance that we do.
Damien Moore.
Mr. Speaker, would my right honourable friend, the Minister, agree with me that to place vulnerable asylum-seeking children in the care of local authorities whose Ofsted rating is inadequate is not only a dereliction of our international obligations, but of our moral ones as well?
Well, the Honourable Gentleman makes an important point. We want to place these minors in the care of local authorities, and of course we want to place them in the care of local authorities that have good track records of looking after young people. And he, I presume, is referring to his own local authority, Sefton, and if there are concerns about their performance, then he should bring them to my attention, in particular to the Secretary of State for Education.
Peter Carr.
Thank you for allowing me to speak in this debate, Mr. Speaker. I appreciate it.
The community I represent here was given just a couple of hours' notice that 96 unaccompanied children were going to be placed in a hotel in the community I represent here. I did visit that hotel within the days afterwards, and I visited many times since. So I can say that to suggest that these are specialist facilities is ignorant.
Exactly.
Yeah. In the days afterwards, I saw for myself, having met the children who were there, that some of them were extremely vulnerable. Vulnerable themselves emotionally, and vulnerable if they should leave the premises to being coerced into crime.
Yeah.
So I contacted the council, I contacted the police, I contacted the social services, I contacted his department, the Home Office. The only organisation that responded, I believe, effectively and with the kind of seriousness that you would expect was Sussex Police. But they lacked the facilities and the resources and the powers to do the job that needed to be done. It is incorrect to say these children are not being coerced into crime, because just last year, Sussex Police pursued a car that had collected 2 children from outside this hotel. When they managed to get the car to safety, they released 2 child migrants, and they arrested one of the members who was driving it, who was a gang leader who was there to coerce the children into crime. So I accept that if one of the uncomfortable truth for us is if one child who was related to one of us in this room went missing, the world would stop.
Yeah.
But in the community I represent, a child has gone missing, then 5 went missing, then a dozen went missing, then 50 went missing, and currently today, 76 are missing and nothing is happening. So my question to the Minister is, when I visit the hotel the next time in the coming days, what will be different there than went before? Because if nothing is different, they are going to continue to go missing.
Well, perhaps the honourable gentleman and I should visit the hotel together when I visit in the coming days and see the facilities together. The assurances that I've had, as I've set out previously, are that when we visit, or if he visits, he will see that there are several security guards who immediately raise with the police any suspicious activity that they find, that there are a number of nurses, and that there are a number of social workers. And so together there is a strong set of support staff on site, that there are robust procedures for signing in and out when young people want to leave the facility, and that as soon as any concern is raised that an individual hasn't come back in the agreed time, that Sussex Police are immediately alerted and that the usual procedures are followed. But I'd take his remarks very seriously, and I will listen to him, and if he would like to meet with me and discuss that, then I'd be very happy to, because it's all in all of our interest to ensure this never happens again.
Thank you, Mr. Speaker. The Minister is demonstrating a lot of seriousness and compassion in gripping this very concerning situation. But does he agree with me that the best way to safeguard these children is to prevent them crossing in the first place? Does he agree with me that it's very, very concerning and actually shameful that opposition members stand up in here having failed to back the legislation that would do that, that will enable us, furthermore, to actually test the age of these children? Does he agree with me that it's absolutely vital that we know that these are in fact children and not dangerous criminals? So does he agree with me, and hope very much that the next time that he brings forward legislation that we will strengthen our sovereign borders, as we as a country have a right to do?
The Honourable Lady is absolutely right. This is a serious issue, but it is a symptom of the problem, which is that people smugglers are bringing very large numbers of people across the Channel, and we have to tackle that with the most robust response we can. The opposition continually oppose any effort by us to strengthen our borders. We will be bringing forward further legislation, and we are, as she knows, reviewing whether we can adopt a more scientific approach to the verification of ages, as is done by a number of our European counterparts. It's absolutely right that we do that, because any adult who poses as a child coming into this country poses a serious risk to the young people who they then live alongside, whether these in these hotels or any other setting.
Russell Moyle.
Thank you, Mr. Speaker.
locally, I'm afraid the council also don't have a grip on this serious situation. They are out of their depth and they are unfortunately in a legal limbo. Past children protection scandals have shown us that all agencies must take both a joint but separate responsibility for the protection and safeguarding of children. We can't have this continued. Home Office pointing at the Council pointing at Home Office, and nothing being done. At the centre of this, it is the Home Office moving children into our local authority wholly outside of the law. The Home Secretary's failure to enforce mandatory requirements to transfer children into foster care is, I'm afraid, creating an unregistered children's home in our area, which is counter to law. This children's home, by the way, is owned by a man called Adolf van Hoedstraten. He changed his name to that. You can guess what his sympathies, where they lie. So can I ask the Home Office Minister very clearly what statutory powers he is using to transfer children into Hove, into this unregistered children's home?
Well, firstly, there's no pitting of the Home Office against the local authority. The Home Office is working closely with Brighton and Hove, and we have a good working relationship. My officials speak regularly to those at the Council, and having spoken myself with the Chief Executive and the Director of Children's Services, I can say that they also feel that the relationship is working. We also work very closely with other partners, including with Sussex Police. Can we do more to strengthen those relationships? Perhaps. And that's exactly what we intend to do, to ensure that we prevent any of these instances happening in the future. As regards to his ideal solution, well, we're in agreement. We both want to see hotels like this reduced and ultimately closed by making better use of the National Transfer Scheme. But that does require local authorities to come forward and to offer up places. That's why we've put in place significant financial support, so there shouldn't be a financial barrier to local authorities investing in more accommodation and indeed in more social workers and supporters.
We need to really speed up questions and answers because a lot of people still need to get in. Damien Collins.
As my honourable friend has said, effective coordination between police, local authorities, healthcare providers within communities where hotels are being used to provide asylum accommodation is very important. We have such a meeting that's been organised for Folkestone and Hythe on Friday this week. Can I ask the Minister whether, if he can't attend, it's going to be virtual participation, that we do at least have relevant officials from the Home Office who are there, who can answer questions of policy and coordinate with the local authorities as well?
I'll certainly arrange that, and Kent, as he knows, has borne a particular burden in this regard, and so it's right that we do everything we can to support them and his constituents.
Mr. Carmichael.
Mr. Speaker, the only thing that's surprising about this whole sorry affair is that anybody is surprised by it. You put young people into totally unsuitable accommodation and then leave them there while the Home Office fails to process applications for young people and for all asylum seekers. This was always going to happen. The Minister announced on the 16th of December a £15,000 extra funding package for local authorities. That is due to expire at the end of February. Is the Minister telling us today that that additional money, not the standard money, the additional money, will continue after the 28th of February or not?
Well, before I arrived in the department in the summer, there was already an initial payment provided to local authorities, which I believe was £6,000 or thereabouts. That did ensure that more local authorities came forward, but given the scale of the challenge that we've debated today, I took the view that it needed to be more, and that's why we made this more generous offer available. We've operated that as a pilot to see whether it encourages more local authorities to come forwards. I am receiving advice as to the number of local authorities that have taken up that offer, and we'll make a decision before it closes as to whether it was sufficiently successful to warrant continuing, but I'm open to continuing it further into the future.
Thank you, Mr. Speaker. Given some of the horrors of war that asylum seekers can witness, they can become desensitised into the difference between right and wrong, and without intervention could pose a threat to society. Could I ask for a formal Home Office investigation into the Afghan asylum seeker Abdul Rahim Zai, who murdered Tom Roberts in Bournemouth last year. Abdul Rahim Zai had a criminal record for murder in Serbia, a criminal record for drugs in Italy, and then threatened his foster carer here in the UK and bluffed his way into our asylum system, posing as a minor. So many red flags, Mr. Speaker, missed that could have revealed what a threat to society this individual was. There are lessons to be learned. Please, will the Minister launch an investigation?
Well, my right-on friend is absolutely right that this is a terrible case, and our thoughts are with the family and friends of Thomas Roberts. As you'll know, sentencing is yet to take place, but we will be investigating the full circumstances surrounding the case so that we can ensure that we learn all the lessons. One that we will certainly be taking forward is, as I said in answer to an earlier question, a more robust method for assessing the age of those coming into the country, taking advantage of modern scientific methods.
Really?
Thank you, Mr. Speaker. These revelations again...
We have Mr. Ali behind you.
Mr. Speaker, one child missing is one child too many. It is horrendous that these children have left their home country seeking safety in the UK only to be put at serious risk because of the incompetence of the Home Office in its failure to ensure basic safety in hostels. Can the Minister explain to the House what measures are in place to safeguard children and adult asylum seekers to ensure no refugee need to face such preventable dangers?
Well, these young people are not being put at risk primarily by the Home Office. They're being put at risk by dangerous people smugglers and criminals, those who smuggle them into the country and those who might exploit them when they're here. So our efforts are focused both on protecting young people in the hotels, as I described earlier, and also in doing everything that we can to fight the people smugglers, whether upstream or here in the United Kingdom, working with the NCA, security services and police forces.
Andrew Bridget.
Thank you, Mr. Speaker. Does my right honourable friend concede that unaccompanied minors in our asylum seeker system are being targeted by criminal gangs? And does he agree with me that we need more resources to tackle the organised criminals who are causing this problem to resolve it?
Well, it's wrong to generalise about where all of the missing young people go. Some leave hotels to meet up with familial contacts. Others, though, he's absolutely right to say, are then drawn into criminality at the behest of people smugglers and trafficking gangs. We are working with the NCA, with police forces and with immigration enforcement to bear down on those gangs. One element of that is the work that we're now doing to very significantly increase the amount of immigration enforcement activity occurring in the UK, including raids of illegal employers such as construction sites, car washes and care homes, so that we can find the illegal employers, issue them with penalties and deter them from taking this kind of activity.
Thank
you, Mr. Speaker. I'm a bit troubled listening to the Minister, because how can he claim that this is a robust vetting procedure when there are still 76 young people missing? This story is yet another failure and a stain on the Home Office. This was entirely unavoidable. We've heard stories of the security failings and the safety about the hotel, and many of those missing are teenagers, young people who are at the prime age of being groomed by criminals who target those 16 and 17-year-olds. So does the Minister not accept that it was a mistake not to ban the placement of 16 and 17-year-old children in unregulated accommodation? And what will he do to end this practice?
Well, I'm not sure what the Honourable Lady is suggesting. If we don't use these hotels, which have a range of security and support staff available to them, is she suggesting that we put them in hotels with adults? She says from a sedentary position in regular hotels. Well, no one would want to do that. So the only alternative to using these settings is for young people to go into good quality, permanent local authority support. And I've already said that we've made available very substantial financial incentives for local authorities to do that. The best thing that we can do is encourage our own local authorities to take part in the National Transfer Scheme and ensure that there's a better solution.
Totally right that unaccompanied asylum seeker children should be safeguarded in the most appropriate settings.
It is totally wrong that there are all too frequent reports of young adult asylum seekers claiming to be children in their asylum claims. Other countries have far more scientific methodology employed to establish the age of a child who won't reveal their true age. Will the Minister urgently bring forward such measures to the House so that they can be approved and introduced?
Yes, well, my honourable friend is correct. And we recently published a report from the Age Estimation Science Advisory Committee on scientific methods to assess the age of asylum seekers and to resolve age disputes. These are widely used practices across Europe, including in Denmark, in Norway and Sweden. We're considering that report, and we will set out further details in due course, because we do need to address this challenge, as he says.
Williams.
Speaker, I declare that I'm a former childcare social worker, a former social work educator and a member of various committees of the British Association of Social Workers. I'm unclear from the Minister's answers so far. Is he saying that there are qualified and trained social workers available on every site 24 hours a day?
Yes.
Andrew Slaughter.
Thank you very much, Mr. Speaker. We persuaded the Home Office that the accommodation where they placed asylum seekers in my constituency was below acceptable standard, and they moved them earlier this month, but they failed to give any notice or tell the asylum seekers where they were going, and some absconded out of fear of that. Will the Minister look at the poor standards and poor treatment by the Home Office and its contractors of asylum seekers, which is at the root of this problem?
Well, as he may recall, one of my first priorities was to ensure the Home Office engaged better with local authorities. And although there's always room for improvement, the level of engagement is now enhanced from where it was at the end of last year. And I continue to push officials to do more and give local authorities more notice either of new hotels opening up or of changes to those hotels. I've also recently met with the providers and said to them that we expect these hotels to be run professionally and appropriately with decent standards of accommodation and food, and that we'll be making unannounced visits of the hotels to ensure that those standards are upheld. If he has any matter he wants to bring to my attention, then please do.
Blake.
Thank you, Mr. Speaker. I would like to just ask a question about the funding for local authorities. Does the Minister realise that for a local government place, the average cost is of nearly £5,000 per week? So £65,000, both of the 50,000 and the 15 that he said, would only cover up to 13 weeks. Now, that's if they're lucky enough to have a local authority placement. If they are to have to go to the private sector, it is up to £20,000 per week, which means that you would only get a coverage of 3¼ weeks from the money that is being provided. Will the Minister meet urgently with officials in the Department of Levelling Up and Housing to urgently come up with a solution that will work for these children so that everyone can take their safeguarding responsibilities seriously and we see no more children going missing?
Well, I have met with representatives of local authorities, London councils, the Local Government Association, and raised this issue. They made the points which many members have made across the House about the lack of general capacity in this area and the cost of providing this care. We did work with DLUC in providing the package that's just been made available, and we'll learn the lessons from that and make any changes that we need to, so there's a fair package of support for those authorities that support the National Transfer Scheme.
Ellen Hayes.
Mr. Speaker, 200 children across the country are missing from accommodation for which the Minister is responsible. That's nearly 7 classrooms of children, about an entire year group in many secondary schools across the country. The complacency of this government is disgraceful. Where is the cross-departmental ministerial task force with the Department for Education and the Department for Levelling Up Housing and Communities to ensure a day-by-day focus on this issue, ensure accountability and drive urgent improvements in the safeguarding of children?
Well, I share the Honourable Lady's concern, and I have already set out the steps that we've taken so far to ensure that the hotels do have significant support attached to them, and the work we're doing to ensure that local authorities can make more placements available in the future. I can assure her that we are working with all of those government departments and indeed with the police to ensure that any young person who goes missing is tracked as far as we can, and certainly to the same standard we would expect of any of our own children.
Castle.
Mr Speaker, I welcome the clarification made by the Minister, but our obligations go beyond simply providing safe and secure accommodation. It's a few years now since I met unaccompanied asylum seekers who were unable to obtain educational maintenance allowance because they couldn't access a bank account because of the complexities and productions that were required. Can the Minister assure me that, as well as safe and secure accommodation, those complexities, the issue of bank accounts may have been resolved, but others will have arisen, are also going to be looked at so that they can develop and flourish whilst they're in our care, whether or not they ultimately remain in this country?
Well, we do take all of those things into account, and that's exactly why we want to ensure that young people get into local authority care where they can have access to education, for example. If he has any suggestions from his own experience, I'd be pleased to read those and to take action accordingly.
These revelations once again expose shocking neglect by the Home Office, failing in its basic duties to unaccompanied children who have often experienced war and persecution. As charities and campaign groups have warned, housing children in hotels without basic safeguarding and measures is unlawful, and now more than 136 children have been reported missing from one hotel alone, and 76 still unaccounted for. I asked the Minister, doesn't this scandal show that it's time for a fundamental change at the Home Office in attitudes from one that portrays people seeking asylum as invaders and denies them their basic rights to a humane approach that cares for those seeking sanctuary?
Well, we do care for these young people and we take our responsibilities to them very seriously. I've set out the safeguarding procedures that we have in place and we're always keen to learn how we can improve those. The key task ahead of us is to reduce the number of people crossing the Channel, and I hope that she will support the measures that we're going to bring forward in the years ahead, because an attitude of open borders and unlimited migration will only lead to more young people placed in these difficult settings.
Claire Hammer.
Mr Speaker, of course today our focus is on acute child protection issues that are flowing from the chaos that the Home Office have allowed to develop in the asylum system. So many children in my constituency and clearly in many, many others have needs and rights overlooked every day. The right to education, space to play and to live a normal family life. And the widespread use of hotels and other inappropriate contingency accommodation is a symptom of, and we're hearing it again today, the Home Office implying that because they don't like an issue that it is just going to go away. The need for international protection is a reality in this world, and this government have a legal and a moral duty to respond appropriately. Isn't it time now for the Home Office, instead of demonising asylum seekers, to get a grip of the processing issues, to create safe routes and to provide a system that is both humane and cost effective?
Well, we are putting in place a comprehensive plan to reduce the backlog of cases, and I can tell her that there's already good progress being made in that respect. With regard to safe and legal routes, well, this country is a world leader in resettlement schemes. More people entered the United Kingdom last year for humanitarian purposes than any year since the Second World War, from Ukraine, from Hong Kong, from Syria, from Afghanistan. So it's simply untrue to say that we don't take those responsibilities seriously. We do think it's naive to believe that if you had a safe and legal route that would stop people crossing the Channel. No evidence supports that position. We want a position based on deterrence, such as our proposal of a Rwanda scheme. We will come forward as soon as possible.
Mr Speaker. Mr Speaker, the former Prime Minister and member for Right Honourable member from Maidenhead raised concerns about safeguarding at the borders. The independent border inspectors raised concerns about safeguarding in the hotels. Action's been taken, but quite frankly, the action that's been taken has been insufficient to mitigate the risk to these children who are being kidnapped, taken away and used in crime, and there's no doubt about that. Local authorities do not have the resources They don't have the social workers. They're recruiting from South Africa in my constituency, 20 social workers. It takes time to train them here. The police haven't got the resources. They haven't got the resources to focus, to give the focus that's necessary to this. So it's important that we use the resources we've got efficiently and effectively, and the only way to do this is to set up a task force and to make that task force accountable, and it be at local level, and then you get your local task forces using the resources efficiently. I don't doubt your commitment to these people, but it's not using the efficient and effective the resources we've got.
Well, I respect the Honourable Lady's long experience in local government, and I appreciate the challenges that local councils face. That is why we brought forward this enhanced financial package. We will be learning from that, whether that is having the desired effect. And I'm very happy to speak with the Honourable Lady if she has experiences from her own constituency.
Mr. Speaker, does the Minister accept that the Home Office has the key responsibility around safeguarding? In responses to the Honourable Member for East Worthing and the Chair of the Home Affairs Select Committee, he hasn't answered. So does he accept that? And with those responsibilities are legally enforceable duties?
Well, the settled position is for a young person to move into local authority care, and for that local authority to accept responsibility for them in the usual way. Whilst the young person is in a bridging hotel, then the legal position is that the local authority has responsibility. But we appreciate that there is a great burden being placed upon a small number of local authorities, and for that reason the Home Office steps up and provides all of the support that's required in and around these hotels.
Cat Smith.
Thank you, Mr. Speaker. Since the Minister's been on his feet responding to this urgent question, there has been a BBC breaking news alert that's highlighted some research done by the BBC about a children's home where children were raising concerns which were ignored. Now, this question is obviously about asylum-seeking children, but the one thing that seems to me to be missing in all of this is children's voices. So when the Minister goes to the hotel in Sussex later this week, he said he will meet with a lot of the adults involved, but can he commit to meeting with the asylum-seeking children and hearing directly from them about their experiences and their concerns?
Yeah. Well, the Honourable Lady makes a very important point, and of course I will do. The evidence that we have available from the ICIBI report of October last year was that the young people that they spoke to found that their needs were being cared for, and they felt that they were happy, safe and treated with respect. But of course I'll do everything I can to satisfy myself that the arrangements are appropriate for them as well.
Gwen.
Thank you. In his answer to my honourable friend, the member for Oldham East and Saddleworth just now, he has basically said that the local authority has corporate parent responsibility over these children in hotels. If that is the case, then I'm afraid the Home Office package to local government is woefully inadequate, something he will know from his days as Secretary of State in that department. But it is his department's, current department's duty to protect those children as refugees. So can he tell the House today how many National Crime Agency officers are working on the serious issue of child trafficking and disappearance from hotels?
Well, to clarify, I didn't say that we were expecting local authorities who were hosting these hotels to provide those services. I said that whilst individuals are in bridging hotels, there may be a technical legal position, but the Home Office appreciates the pressures on those local authorities placed by having a hotel, which we don't want to be a permanent fixture. And it's for that reason that we're putting in place all of the support which meets the needs of the individuals and the costs associated for the local authority. With regard to the NCA, I met with them only last week. We now have this as one of the most significant priorities of the organisation. A very large number of their personnel are engaged in tackling organised immigration crime, including people trafficking and modern slavery.
Patrick Reddy.
Positive action in housing have highlighted the case of a family, including a 4-month-old child near Glasgow, who, as a result of trying to claim asylum through a safe and legal route, were evicted from their provided accommodation and left in the street for hours in sub-zero temperatures. Does that case, and what's happening in Brighton, not show that creating a hostile environment for immigrants and refugees and asylum seekers is still the government's policy? And does it not also show that actually it doesn't work and it needs to change?
Well, those are his words, not mine. What we do want to do is to distinguish between those people who come to this country fearing persecution and fleeing war and human rights abuses, and those who come here for economic purposes. And we on this side of the House are capable of making that important distinction. Where those people are coming here with no genuine right to asylum, gaming the system on small boats, and it's absolutely right that we take a robust line. It's also appropriate that we bear down on illegal employers using a range of measures through our compliant environment, because those are the very people that are perpetuating this evil trade and giving work in car washes, care homes and construction sites for these individuals.
Neera Wilson.
Mr. Speaker, in the Minister's answers to various members, there seemed to have been quite a lot of verbal gymnastics about the legal status of these of either the Home Office or local authorities with respect to these children. Can he clarify, for the record, will the Home Office take legal responsibility for these children until they are properly placed in local authority care? And why won't the Home Office take on corporate parenting responsibilities, regardless of where these children have come from, how they got here, or what gender they are? These are vulnerable children who need our protection.
The Honourable Lady may know the recent history of this issue, which was that previously young people were primarily being placed in Kent, who then took legal responsibility. The numbers arriving in Kent were sufficiently high that Kent chose to walk away from that responsibility. We understand the reasons behind that. Since then, where children are not placed immediately within a local authority, we've had no choice but to stand up these hotels. And as I said in answer to an earlier question, that means that the Home Office provides all of the support services that are required. We're considering the proposal that's been made by a number of organisations about acting as corporate legal guardians of the young people, and we'll make a decision on that in due course.
Jim Shannon.
Mr. Speaker, can I thank the Minister very much for his answers. He's obviously trying very hard to try and address the issue. I attended just last Friday the launch of a new website for Bees Needs. It's a phenomenal early years centre in Newton Ours. The joy on the children's faces was real. I was struck, Mr. Speaker, with the responsibility to ensure that asylum seeker children are given the gift of learning and education. So what has the Minister, along with other departments, put in place to see to their educational needs, as well as acknowledging that the asylum process can take over a year, which cannot be undone in a child's life? Thank you.
Well, under-18s do receive access to education, and that's clearly best provided when they're able to be in a local authority setting, and that's why we want to get young people out of the hotels as quickly as possible. We work with local authorities and provide them with the support that's required so they can provide education until these individuals' cases are decided.
We know that completes that urgent question. We're now going to come to the next urgent question. Members like to leave, please do so. Ben Bradshaw.
Thank you very much, Mr. Speaker. To ask the Second Church Estates Commissioner if he will make a statement on the outcome of the meeting